If you are considering enrolling in Medicare supplement coverage, you can avoid critical mistakes by watching this video before you make your coverage decisions. My name is Cameron Giardini, and together with my family, we operate Giardini Medicare, which is an independent insurance agency based in Michigan that is 100% focused on helping people find and enroll in Medicare Supplement or Medicare Advantage coverage. Over the last several years of helping thousands of people with their transition to Medicare, we have seen some common mistakes that people tend to make when it comes to choosing Medicare supplement coverage. Now, we will share those firsthand with you. In addition to the 5 most common mistakes we see when it comes to choosing Medigap coverage, we will make sure to tell you how to avoid these mistakes. After all, what is the point of focusing on problems without providing solutions? Let's kick things off by answering a question that many of you might be thinking. What exactly are Medicare supplement plans? First, just know that the term Medigap is also the same as the term for Medicare supplements, so when you hear us talking about Medigap, just know we are talking about the same thing as a Medicare supplement plan. Overall, Medigap plans are health insurance policies offered by private insurance companies that work to fill most of the financial gaps left by Original Medicare, which is Part A and Part B. These include things like coinsurance, copayments, and sometimes deductibles. So think of Original Medicare as your basic layer of protection. It's good, but it's not foolproof. That is where Medigap comes in, covering all of or most of the 20% cost sharing that Original Medicare leaves on your plate. When you enroll in a Medigap plan, Original Medicare, it remains your primary insurance coverage, and your Medigap plan becomes your secondary coverage. Essentially, it fills the gaps, ensuring that you are not left with unexpected medical bills. Because providers will be billing Medicare as your primary coverage in this case, having a Medigap plan, it allows you the freedom to see any provider that accepts Original Medicare across the country, and prior authorization for services is rarely ever involved. Here is where it gets interesting and more complex. Medigap plans, they are standardized by using different plan letters which range from A to N. Each plan letter represents a different set of standardized medical benefits. So it is crucial to pick the one that aligns with your needs and your budget. Like all things relating to Medicare, it will probably be easier to understand these plan standardizations with a visual aid. To do this, you can go to page 76 in the 2023 or 2024 Medicare and You book, like the one you see right over here behind me. There you'll find a comprehensive chart that breaks down the standardized Medigap benefits by each Medigap plan letter. We'll also link to a chart in the show notes for easy reference, and you can also see that chart on the screen here. Trust me, it is an image you will want to bookmark and remember for the future. So now that you're familiar with the basic Medigap plans, it's time to highlight the 5 mistakes when it comes to choosing one for yourself. Now, mistake number 1 is not knowing your state's unique Medigap market. You might think that because Medicare is a federal program, that the rules for Medigap coverage should be the same in every state, right? Well, unfortunately, that's not the case. For the most part, Medigap plans are regulated by individual states' Department of Insurance, and because of this, Medigap rules and pricing can vary significantly from one state to another. It's just like driving. The basic rules are the same, but each state has its own traffic laws that you need to know. And of course, the same goes for Medigap. Here are some of the ways that Medigap plans can vary from one state to the next. First, although we told you that Medigap plans are standardized based on their plan letter, this is not true in a small handful of states. Minnesota, Wisconsin, and Massachusetts don't standardize Medigap plans by plan letter, with Massachusetts, for example, classifying Medigap plans as Core Plan, Supplement 1 Plan, or Supplement 1A Plan. And Wisconsin and Minnesota also have their own unique standardization and classification for Medigap plans. Also, if you have done some digging into Medigap plans already, you may have seen the different ways that Medigap plan premiums are rated. And no, we are not talking about star ratings. Medigap premiums are rated either as attained age, issue age, or community rated. These rating systems, they impact how Medigap plans are priced as well as how their premiums increase over time. Now, before you rush off to find a plan with a specific type of premium rating, just know that different states may mandate certain premium rating systems, while others simply might have a much higher prevalence of one rating system than the rest. Here is a map showing the common Medigap rating systems across the country, and we dive deeper into this topic in our video about Medigap premium increases. So make sure you watch that video as well. Now, as a brief example of how the monthly premiums for Medigap plans can vary greatly from zip code to zip code and state to state, here are some real-life examples of possible Medigap Plan G pricing for a 65-year-old male non-tobacco user. So in Southeast Michigan, it might be $130 per month, while in Naples, Florida, it could be $190 per month. Omaha, Nebraska could be $115 a month, and lastly, Seattle, Washington might be $170 per month. And again, that is the same Plan G with the same basic benefits. Lastly, you may already be familiar with the fact that most of the time, if you want to change from one Medigap plan to another in the future, you will have to do so by going through what is known as medical underwriting and qualifying for a new plan based on your health and pre-existing conditions. Now, the reason I say most of the time is because this is not true in every state. For instance, some states have birthday rules, anniversary rules, or other guaranteed issue rules that will allow you to change Medigap plans without answering health questions or facing certain restrictions. So, knowing state-specific rules will be a game changer in your Medigap journey. You can see here a map of different states that currently have or will have in the near future unique rules about changing Medigap plans. We will also link to a guide in the description below this video, which provides more detail about these states' unique Medigap rules, and there are more states that seem to be getting added every year. So beyond just knowing that Medigap plans can vary from one state to the next, how do you avoid making the mistake of not considering your own state's market? First, don't get too caught up with the general content and advertisements you see online. Social media and YouTube, they can be a great learning source, but don't get too fixated, for example, on getting a Medigap Plan N if you live in Massachusetts. And don't fixate on choosing an issue age Medigap plan if you live in Michigan, where it is much less common.
Yes, but I want it.
Instead, we highly recommend you consult with an independent broker who is familiar with the market in your state, even if they do not live in your same state. They just have to know the market. You can also check Medicare.gov or use a SHIP counselor to see Medigap plan options, but even though we are biased, we know a broker will be one of the best resources that you can use, and our services, they cost you nothing extra. If you need to connect with an independent broker, just use the link below in the description of this video. Now, before moving to the next mistake, real quick, we now also have a free online course that you can sign up for to learn about hundreds of Medicare topics for free at your own pace by going to gmedcourse.com. And with that out of the way, mistake number 2 is misunderstanding the Medigap open enrollment period. This is an extremely important window of opportunity which lasts for 6 months, and it starts the first day of the month you are both 65 or older and enrolled in Medicare Part B for the first time. During this Medigap open enrollment period, insurance companies, they can't turn you down or charge you more based on your health or make you wait for Medigap coverage to start. It's like having a VIP pass to the Medigap world.
I got a golden ticket.
The official Choosing a Medigap Policy handbook even labels this as the best time to buy a Medigap policy. So you don't want to let this enrollment period pass you by. We will also link to a PDF of that Choosing a Medigap Policy handbook in the description below. However, there are also common misconceptions that can trip you up. First, some people don't even know that the Medigap open enrollment period exists. If you're listening to this episode, luckily that is no longer the case. Second, many people confuse the annual election period, which is known as AEP. This occurs from October 15th through December 7th. They confuse that with their individual Medigap open enrollment. These are not the same. Although AEP is commonly and somewhat incorrectly referred to as open enrollment, the fall AEP does not give you a free pass to switch Medigap plans without health underwriting. And lastly, many are unaware that if you were on Medicare before turning 65 due to disability or other criteria, you actually get a second shot at a 6-month Medigap OEP starting the month you turn 65, just like anyone else. So mark your calendars and set those reminders if that applies to you. Now, knowing about the Medigap open enrollment period is is a big piece to the puzzle when it comes to avoiding mistakes associated with that enrollment period. So as you approach age 65, even if you plan on continuing to work and delaying Medicare past age 65, make sure you take some time to understand the timeline to your individual Medigap open enrollment period so you don't let it pass you by once the time comes. Remember, your Medigap open enrollment period, it occurs when you first enroll in Medicare Part B and not just when you turn 65 and become eligible for Medicare. For example, if you delay Part B of Medicare until age 70, you can still have your Medigap open enrollment period when enrolling in Part B at age 70. This might happen if you're continuing to work beyond age 65, like we talked about. We have personally helped customers of ours use their Medigap open enrollment period as late as their 80s since they delayed Medicare due to having employer coverage for that many years. Also, many people think that because their Medigap open enrollment period begins when their Part B is effective, that they have to wait for their Part B to actually be in effect before enrolling in a Medigap plan, when in reality, there are many insurance companies that will let you submit an application and enroll in a Medigap plan using your Medigap open enrollment period up to 6 months before your Part B even becomes effective. So for example, if you plan to start Part B and Medigap coverage in June, you can still likely enroll in a Medigap plan in the beginning of that same year. This will let you get a long head start so you don't have to scramble to get your Medigap coverage as your Part B effective date approaches. But also keep in mind that this won't actually make your Medigap effective date be sooner than your Part B effective date. In this example, even if you get a head start and apply in January, you will still have to wait for June for your Part B and Medigap coverage to take effect. Now moving on to mistake number 3, which is only considering one Medigap plan letter. Imagine walking into an ice cream parlor and trying vanilla when there are dozens of other flavors to explore. Although I love vanilla, that is what you are doing if you fixate on just one Medigap plan letter, like a Plan F or a Plan G, when you're first considering Medigap options. While it's true that each plan letter offers specific benefits, limiting to yourself to just one can mean missing out on a plan that might be a better fit for your unique healthcare needs and budget. This is especially important to remember when searching social media and YouTube, since you will see posts claiming that one Medigap plan letter is the best option available for everybody. And they also say that you would be crazy to consider other plan letters. But is that really the case? So the key here again is comparison. Again, Medigap plans are standardized by plan letters which range from A to N, and you can see the coverage differences using the chart highlighted from the Medicare and U-Book. Now, we aren't saying you should get quotes for every single plan letter from every single company, since many of the plan letters, they do not make financial sense based on the coverage they provide. But we do highly recommend consulting with an independent broker to get quotes for at least Plan G, Plan N, and possibly high deductible Medigap plans. You may be tempted to gravitate towards Plan F, but it's important to know that only individuals who are first eligible for Medicare before January 1st, 2020 are eligible to purchase Plan F. And more importantly, even for those that are eligible for it, we tend to find that Plan G and or Plan N provide better value based on monthly premiums and coverage. But again, Medigap plans vary greatly from one state to the next, so make sure you consider plans in your specific market. Your first time starting Part B, it might be your only chance to look at all Medigap options, so make it count. Make sure you explore the full menu of Medigap options during your transition to Medicare. Now we have mistake number 4, and this is a big one, and that is choosing the cheapest plan just because it's the cheapest. Now let's talk about a mistake that's as common as it is tempting, which again is choosing the insurance company offering the cheapest Medigap plan that you can find. Although Medigap plans have basic benefits standardized by their plan letter, their monthly premiums are not standardized. This means that a Medigap Plan G with one company can and likely will be cheaper than another insurance company offering another Plan G with essentially the same medical benefits and coverage even in the same zip code. This is exactly why it is tempting to enroll with the insurance company offering the cheapest plan on the market. It's completely natural to want to save money, especially regarding healthcare costs. But when it comes to choosing Medigap plans, opting for the cheapest option, it might save you a few dollars now, but it could cost you in the long run. But why is this? Well, because the initial monthly price you pay for Medigap coverage, it is not set in stone. It is subject to premium rate increases over time while you're enrolled in the plan. And like we have talked about in our previous mistakes, after your Medigap open enrollment period, in many states and circumstances, you might not be able to change to a new Medigap plan based on your health at the time. So don't immediately enroll in the insurance company offering the lowest price for a Medigap plan letter that you want. Medigap premium rate increases, they are influenced by various factors such as insurance company size, number of Medigap enrollments, market strategy, and even state regulations. Some smaller insurance companies, they might offer the lowest initial price to attract new customers, only to increase those prices greatly in the future. We will sound like a broken record, but it is crucial to work with a knowledgeable independent broker who can guide you to a plan that not only fits your budget today, but also has a history of relatively stable rate increases. At the end of the day, no one knows which company will have the most stable rates going forward, but we can hopefully use experiences from the past to make a good educated guess about the possible options you have. After all is said and done, you may still find that the cheapest offering is actually the right one for you, but it will take a lot of work to know this by just looking at pricing online with Medicare.gov or other sources. Thankfully, we will also have a separate video that is completely devoted to a deep dive of how Medigap plan premiums increase over time, so make sure to watch that video to learn more details about that. Now we move on to our fifth and final mistake, which is choosing a Part D plan simply because it matches your Medigap company. So again, our fifth and final mistake, it does not directly relate to choosing Medigap coverage. It is nonetheless very important, since if you enroll in Medigap coverage, it is almost certain you will want to enroll in a separate Part D prescription drug plan to help with your routine prescription medications. Part D plans, they are not part of original Medicare, but instead they are offered by private insurance companies that contract with Medicare. Some insurance companies will offer both Part D and Medigap plans. So if you choose a Medigap plan with one of these companies, you may want to make things easy and choose one of the Part D plans that they offer. You might think, well, it's the same company, so must be good, right? Wrong. While it may seem convenient to have all your coverage under one roof, it's not always the best financial or even medical decision for you. Each Part D plan has its own monthly premiums, out-of-pocket costs, preferred pharmacies, and formulary, which is the plan's list of covered prescriptions. Just because a company offers a great Medigap plan, it doesn't mean their Part D plan will be a good fit for your unique medication needs. You could end up paying more for prescriptions or find that your specific medications aren't even covered by that plan. So to avoid getting a less than ideal Part D plan, make sure that regardless of your Medigap insurance company, take some time to run a Part D analysis of all the Part D plans on the market by using the online plan finder tool on Medicare.gov. We have another video with a step-by-step guide for choosing Part D plans, so make sure you watch that for more of a breakdown. Typically, we find that people who incorrectly choose a Part D plan that doesn't match their prescription needs, they do so because they call an insurance company directly to enroll in a Medigap plan. Then, the representative on the phone offers them a Part D plan from that same company if one is available.
Take it or leave it.
Remember, if you call an insurance company directly instead of using a broker, they're not going to say, well, now that we enrolled you in a Medigap plan with us, we recommend this Part D plan that works better for you from one of our competitors. It's just not going to happen. Overall, we aren't saying to never choose the same insurance company for Part D to match your Medigap plan, since it could certainly make sense to do so, but at least compare all of your options first. Now that we've discussed the common mistakes we have seen people make when it comes to Medigap plans, let's talk about the elephant in the room. The impact of these mistakes on your Medigap coverage. In the short term, you might not notice much. You may think you're saving money or you've got everything covered, but as time goes on, you may find you don't have as good of coverage as possible based on your needs, only to realize it might be too late to make a change. Make sure to leave us a comment below if you have any other Medigap questions you have, or questions you want us to answer for you about any Medicare topic. And also make sure to share this video with a friend or family member who is trying to avoid making mistakes when it comes to choosing Medigap coverage.